Good afternoon. I'm Carol McGruder, and I'm the co-chair of the African American Tobacco Control Council. And we're here today in beautiful Bayview, San Francisco, to have, we called it a fireside chat, but we should have said an afternoon tea chat with our District 10 Supervisor, Shamann Walton. Before we get started, I just want to recognize a few people that are in the audience and some of our staff that are here with us. And so I want to recognize, first of all, Tracy Brown, who is our Artivist Program Manager with our Saving Black Lives project. The website for that is savingblacklives.org. And then we have Ms. Yolande Burrs, who's our Program Manager with Amplify.love. And that's the program that we have that's really about building the capacity of our community and helping people to navigate the tobacco control universe and also working on social determinants of health. I want to thank Joan Taylor, who's our fiscal manager with the Erster Institute, who's our fiscal agent. I want to give special thanks to Chef Eskander and Radio Africa. They have long been community partners with us and provide really healthy and wonderful food for our community here in Bayview, which at one time was kind of a food desert, but we're coming around with Radio Africa and Cafe Envy and Auntie April's, and just happy to have some nutritious food for our folks. I also want to thank William Hammond with Urban Advantage. He's responsible for our technology and getting us out on the World Wide Web. We have many VIPs here, but there's a special one that I want to take a minute to recognize, and that's Mr. Willie Radcliffe, who's the publisher of the San Francisco Bayview. Yes, let's give him a hand. He and his wife Mary have been champions for the Black Free Press. Their newspaper is read all over the country, and they really reach out and work with our incarcerated brothers and sisters and let them know that they are not forgotten by their people here on the outside. And we're just honored, Mr. Radcliffe, that you could join us today. So we're going to go on and get started with that. We're here with our supervisor, Shamann Walton. This is the neighborhood where I grew up, and even though I'm not a voting member of District 10, I feel like you are my supervisor, and this is what I call my African village, because I'm very concerned about everything that goes on here in Bayview. So Supervisor Shamann Walton was born in San Francisco and lived in public housing at an early age in Bayview and Potrero Hill. He has worked in District 10 neighborhoods for decades and has witnessed firsthand the challenges our communities face, from longtime residents being pushed out of the city to losing childhood friends to violence and incarceration. The story of all of us who grew up here in Bayview. As an accomplished and experienced community leader, Shamann has dedicated his life to improving these realities in our community and is committed to identifying solutions to our pressing issues. He has a proven track record of creating positive change in the community. He serves and has been a driving force behind San Francisco's groundbreaking legislation, Proposition C, which is one of the main things that we're here to talk about today. But he's also a former president and past member of the San Francisco Board of Education, which is very important, and he's worked to close the achievement gap. He's worked to protect undocumented students, to decrease teacher turnover, increase graduation rates across the district for Black, Latino, and Pacific Islander students, and he's securing financing for a new school that will be built in Mission Bay in the next few years. So welcome.
Thank you so much.
Okay, and I want to start off a little different. I think you saw this picture, but I want to put this picture there.
Yes.
This year we lost a woman, a warrior, a mother of our community who was very close to both of us. And I'm talking about Miss Oscarine Winfield Williams. And so her service was earlier this year. And she was someone who was my cheerleader, my champion. And I'm going to give you a minute to tell your story about her. But the things that I learned from her were to be yourself, to bring joy to what you do. She loved our people. And she always encouraged me in whatever I was doing. She had a way of making you feel like you were the only person in the whole world that mattered to her, when she had literally thousands of people who felt that way. So we are going to miss her, and I bring her spirit down to be with us today. I know she's laughing, and I know she's happy and joyed that we're here together having this conversation.
Definitely.
Yeah.
Definitely.
So could you just share one story or memory of her, and then we'll get into our conversation.
Well, I definitely have, so many memories. Miss Williams was very close to my mother. And in fact, at a young age, there was a point in time where we even had to live in her home. She took us in while we were going through a transition period. But so, she's always been known to me as Auntie Reen. And of course, all of her children are my older cousins. And I was fortunate enough to have an opportunity to work for her at the Potrero Hill Family Resource Center on 2 stints and 2 different occasions. And so to have her as an aunt, to have her as a family friend, and then to have the opportunity to work for someone who was so dedicated to community, so focused on making sure that young women in particular that looked like me had opportunities and advantages, and she was so focused on making sure that early childhood was not only a respected field, but making sure that our babies had opportunities to be successful and get the things and the support that they needed. Our birthdays were 3 days apart, and so just in terms of where I get a lot of my stubbornness, a lot of my focus on making sure that I remain resilient comes directly from her and her mentorship and her leadership, and from watching her do everything that she did in community. And I got my first job back home in San Francisco working for her. And so everything that I do, from running the Potrero Hill Family Resource Center after her, to going on to become executive director of Young Community Developers, and eventually being elected on the Board of Education and the Board of Supervisors, none of that would have happened without her leadership and without her mentorship throughout my entire life. And so I miss her a lot. I rely on her memory and her spirit, yes, and a lot of the things that I do on a daily basis. And her legacy will never be forgotten. It
will never be forgotten, yes, in this city. And so, and I want to just jump on that, how important early childhood education is, and that's something, it's one of the easiest fixes, is to help children 0 to 5 right, have a safe, happy childhood until they get to the public school system. Right. And it's something that we need to put more money and resources and energy into, and valuing the people who work with our babies right, more, giving them more respect and more money. One of the things that we talked about before we turned the mics on was our African American Tobacco Control Leadership Council that I've worked in many areas as well, parenting and AIDS, and tobacco control just kind of took over my life because I saw the injustices and how the tobacco industry just preyed upon us, and that tobacco was our #1 killer more than everything else combined, and so little was being done about it, and so little it wasn't put in the context that it needed to be put in, that this is really an issue of social injustice. So we formed our council about 11 years ago, and we're all over the state, and we're concerned researchers, advocates, and we all have been touched personally by tobacco. And so when I'm all over the country doing what I do, and we talk about some of the issues that we're going to get into, I grew up in this neighborhood, I know all about it, and that we still have to, many of the tobacco control things that we want to do, like getting rid of these Newport cigarettes, the menthol, and these other products, people talk about the unintended consequences that might happen. But we know what the intended consequence is, because the intended consequence is 45,000 dead black people in this country every single year. So we're going to get to Proposition C now. I want to hear from you how it came about, how you got involved with the whole getting these e-cigarettes off of the market, and then we'll get into the conversation about that.
Well, a big part of it just comes from, wanting to be protective of your community. The moment I got elected last November, I knew that Jewel had actually had property here in District 10. And so, naturally, myself and a lot of our parents and families did not want a company in our district that was aggressively targeting young people, and in fact responsible for young people becoming addicted to nicotine, even though we fought for so many decades to decrease tobacco usage and to change the dynamic in terms of the number of folks using nicotine products. And so I found out they were in my district, had a conversation with them along with a parent. And it's funny because our meeting, and our only meeting, they said that they were 100% about harm reduction. They weren't connected to big tobacco at all. And I informed them of the numbers of middle school and high school students that were becoming addicted to nicotine because of their product, and that trading one nicotine addiction from another does not equal harm reduction.
That's right.
And they promised that there was no connection to big tobacco. And a couple of weeks after that meeting, they were 35% of their company was bought out by Altria, which we know is connected to big tobacco in a major way. And so from that, I knew, one, that they were a dishonest company, and that I wanted to continue to work to keep young people healthy and to let Jewel know that we were not going to be supportive of their products. And so City Attorney Dennis Herrera and I got together and co-authored Prohibition on e-cigarettes here in San Francisco, particularly until the FDA had a chance to conduct clinical trials and rule how you should market a product like e-cigarettes. And we knew all the information in terms of young people becoming addicted. We knew that this was a dangerous product, and we knew that they were coming in different flavors and colors and really being aggressive at going after young people. So we got the prohibition passed unanimously at the Board of Supervisors. The mayor passed the prohibition. We took care of that in June. And then here comes Big Tobacco and Juul with Prop C, which would, one, overturn our flavored tobacco ban here in San Francisco that the voters passed in 2018. Prop C would also overturn our prohibition on e-cigarettes that we just passed unanimously at the Board of Supervisors in June. But the scariest part about Prop C and why everybody needs to vote no on Prop C is because it would basically allow Big Tobacco and Juul to write their own regulation and their own laws. That means it takes the power away from the voters. It takes the power away from the legislature, the people that the voters put in place to make laws to help protect our young people and to keep people healthy here in San Francisco. And so we cannot support an initiative that, of course, is pushed by Big Tobacco, pushed by Juul to regulate itself.
Right, and I want to say about Juul and the e-cigarette, the marketing. When the FDA in 2009, President Barack Obama signed the Tobacco Control Act, which gave the FDA the authority to regulate the tobacco industry. And it was at that time when all the flavors for cigarettes were taken off the market except for menthol. And that was where our organization, our council, got involved, because menthol is what black people smoke, Newports in particular. And there's a reason for that these products were dumped in our community, given away to children for free. And so while we saw this firestorm of children across this country vaping, they were seduced by social media, many things that parents that were not paying attention to of how, the Instagram and these social media get in and are selling things to our children. But actually in our neighborhoods back in the day, when I was growing up, and you probably were younger, they were giving away Newports to children, physically giving them to them. And so people like Dave Chappelle is the youngest one that we know was given cigarettes for free at Metro DC when he was 14 years old at the Metro station, and that's how he began his lifelong addiction with nicotine and tobacco products. So one of the things that Juul did, and San Francisco, we're a city of disruption, so we're ahead of the curve on so many things with needle exchange, which e-cigarettes try to position themselves at their harm reduction, which they're not. I fought for needle exchange here when we had the beginning of the AIDS epidemic, and San Franciscans, we didn't want to go out and give everybody in the city a needle and say, if you decide you want to be an IV drug user, here it is. It was about exchanging something for people who are addicted to a substance. So even if we were going to have the position that e-cigarettes could help people, could help smokers, they recruited millions of children who would not have ever picked it up.
That's right.
And their position of, once they got caught with their hands in the cookie jar, of really trying to get into the black community and getting taking a page from the playbook. One of the people who's not here today is Dr. Valerie Yerger, who's on our council, and she wrote a research article years ago about smoking with the enemy and how the tobacco industry just systematically got into our leadership groups, our sororities, our fraternities. Ebony and Jet were built on Newport advertising. And so they were trying to pull this playbook out. And our council, we were so enthused by our young African-American leadership. So people like before you came, Malia Cohen had broke bad here in San Francisco and had the citywide restriction to get flavored tobacco, including Newports, off the market, and we had the referendum, and San Franciscans voted 68% to keep these products out. So we have Malia, there's a brother on LA City Council, Marquise Dawson Harris, and London Breed, who's our mayor of San Francisco. So it's a new day. Have you ever had any type of industry, before your meeting with Jill, have you had any type of approach by some of these entities to give you funding for your campaigns or for projects that you might be working on?
Well, in San Francisco, everybody wants to be connected to people who make decisions. So I've definitely had conversations with bad actors across several sectors here in the city. Big Soda a few years ago, when we were going for the tax on soda and sugary beverages here in San Francisco, while I was in office on the Board of Education, definitely approached me and some of the Democratic clubs that I was a part of to provide resources. And of course, we turned them down and refused to work with them because we knew the harm that they were doing in our communities. And Big Tobacco is no different. They spend an innumerable amount of money to try to get people to support their negative behavior, to support their products, and they show no shame. In fact, they've spent over $12 million here in San Francisco just to support and push Prop C, but there's also millions more dollars going into advertisement of their products, not only here in the city, but across the state of California and across the country. And Big Tobacco has always been willing to spend astronomical amount of money to promote unhealthy behavior and promote products that are very harmful. Mm-hmm.
And so what I had started to talk about was how we disrupt things. And so there's a good and bad of that. But so we did needle exchange, marriage equality, which now is legal in the United States. Right. And so when you instituted this prohibition on the sale of these products pending FDA review, that was before all the news on vaping deaths. That was before other cities, counties, and states jumped on the bandwagon. And people were once again kind of looking at San Francisco like, what are they doing out there? So when those things started to happen, what did you think? How did you feel?
Well, in the beginning, people said, I was crazy. City Attorney Herrera was crazy. We were trying to create another nanny state type of restriction. And it just looked at it as crazy San Francisco. But we had a lot of data and information about the harm it was doing, particularly to young people, and the fact that there was no scientific evidence to support this harm reduction model that they were talking about that they had that was in place. And so the one thing for me is always just about focusing on doing what's right and understanding that sometimes when you make the decision to do what's right, you may be massacred in the media, or people may think that you're doing something wrong. But being in leadership positions before, being on the Board of Education and actually pushing out Teach for America, and the media feeling a certain way about that because they had a strong communications arm to support their initiative. And so I had been in a position where I made decisions that people didn't agree with, but you pray on it, you focus on what is the right thing, and I am never scared to do what we know is right for our communities, and therefore it didn't deter us because of some of the, at the time, thought to be negative publicity.
Right. So now the world is watching. We've had international press here seeing what San Francisco is doing. Everybody's paying attention. So we're going to find out on November 5th how the voters feel about this. With Juul in particular, the FDA had been here and raided Juul's office, and there had been a sub-congressional hearing about a month or so ago, and I happened to had the fortunate, was able to be back there with Dr. Yerger. And our lion, we lost another lion, Representative Elijah Cummings, yes. And that he was the chair over the subcommittee, and he came just to ask one question. That's right. And we were sitting there in the front row, and he came in, and we could see that he wasn't in the greatest of health, and they helped him into a seat. But once he got in his seat, and once he took that microphone, he asked them questions that were specific about San Francisco. And I don't know if he was aware that you were a co-author of this ordinance or not, but we were so proud, and you're trying to be there and keep your decorum, but once he started talking about San Francisco and how Juul was trying to overturn our local authority here to protect our kids and our citizens, we were so proud. So we want to play that clip of Elijah commenting, let our audience see it, and Definitely. Then you can tell us how you felt when you heard about it.
Thank you.
Statement that, quote, we are as committed as ever to combating youth usage, but don't take our word for it. Look at our actions, end of quote. We are looking at your actions, and they are deeply troubling. In 2017, the city of San Francisco banned flavored tobacco products. Then big tobacco company R.J. Reynolds tried to reverse that with a ballot measure. The voters rejected big tobacco and upheld the flavor ban by a whopping 68%. Last month, San Francisco banned the sale of e-cigarettes. Just like your fellow big tobacco company, Juul is trying to overturn it with a ballot measure. But your ballot measure is even bolder than R.J. Reynolds. Beyond overturning the e-cigarette ban, is it true that it would also repeal the flavor ban 68% of San Franciscans already approved?
I'm sorry, Chairman, if there's a provision in that, I may be unfamiliar with this, but are you suggesting that there's a provision in that legislation that would repeal flavor ban on cigarettes,
Yeah.
on combustible cigarettes? I'm not aware of that. I personally would not support that.
Kids are essentially, especially attracted to flavored tobacco products, and you know that, right? Would you agree with me on that?
We've taken direct action against the
Well,
those
but would
concerns.
you agree with that? I just asked you one sentence. Young people are attracted to flavored tobacco products, yes or no?
We've certainly heard that concern, and we've taken action against.
The National Institute on Drug Abuse found that 66%, and this is very interesting, 66% of teenager e-cigarette users believe the product only contained flavoring. They do not realize there is nicotine. So it's shameful to fight cities that find flavors too dangerous for kids.
So,
You agree?
so unfortunately, that was quite a flawed study. I agree with you, right, that if underage consumers are being attracted to flavored products and getting access to it, then we need to do something about it.
Okay.
And those are the actions we wanted to allude to when we pulled those flavors proactively off of the market.
But your ballot measure goes even further. It would preempt local public health laws, effectively barring local bodies from protecting their communities. Do you believe that Juul knows what is best for local communities better than the communities themselves?
Congressman, I'm not nearly familiar enough with the details of that law to comment on it, but I can tell you you've piqued my interest, and I'm certainly going to investigate this with my team afterwards.
How long have you been in your position?
Well, the company in some form or another was started out of graduate school back in 2007, so for a long time.
Thousands of retailers have been caught selling your products to children. Your ballot measure also seeks to insulate those peddlers from liability by raising the standard to, quote, knowingly, end of quote, selling to minors. If you wanted to keep your products away from kids, you would support holding bad businesses accountable for illegal sales, not adding loopholes. How does making it harder to hold retailers accountable for selling your product to children help keep your products out of children's hands?
Again, Mr. Cummings, Congressman, I don't know the details of that, but you've very much piqued my interest. I hear your concerns, and I thank you very much for asking these questions in a way that we can go investigate and take some proactive steps to get back to you.
Well,
we certainly will do that.
Yeah, what I will do is I will prepare a series of questions for you, and I'd like to have the answers, and then I'm going to encourage the chairman to perhaps bring you back so you can answer all the questions, because I think this is a very urgent issue. Thank you very much, Chairman.
So,
Wow.
how did you think when you saw that?
Well, first of all, once a fighter, always a fighter, and definitely praying for Congressman Cummings' family, and just excited about the legacy that he provided for young black men like me. But to see us pass legislation here in San Francisco end up being something that he pushes on right in a hearing at the congressional level, it's exciting to be connected in that way and in that manner. And so I'm happy that he was a champion for so many things, civil rights, justice, but also being a champion for pushing to make sure that in our municipalities, we're actually able to protect our communities and pass laws that are going to be what's right for the people who live in our cities. And so seeing him do that, and seeing, of course, the deception that was presented by Jewel tells it all.
Right, and so we were there. It was just so exciting, and to see the non-responsiveness and the way he kept coming back and laying a foundation. And that was one of the things that we so enjoyed being there, because so many of the questions, they were questions, but it laid a foundation for the future and to set the stage for what can happen nationally, what the possibilities are. I was surprised when he passed. I didn't know how old he was, but I was surprised to find out that he was only 68 years old. And we know that he's a man that had a lot of stress in his life, a lot on his shoulders. And one of the things that our council, we are really concerned about our men, because our men, there's a particular type of war that's made on black men in this country. And for a black man to get to 70 years old is no easy feat. And so when, in the tobacco control work that we do, we want to really address our community comprehensively, and we want to really get our people to start feeling, to fight about having good health, to fight about having healthy communities. And with the tobacco industry preying on us, many of our groups now, you know, it's a new day. So we've had Delta Sigma Theta sorority. They were the first national organization of that stature to sign on and say, yes, we want mentholated tobacco products out of our community. That was followed up by the National Association for the Advancement of Colored People with a resolution that started in Berkeley, California, where I was living, went on to the state of California, was passed and ratified. And recently, Jewel had made a play for the National Association of Colored People on that national level, and they had turned them down because it's easy for them to position themselves that they're going to save the black smokers of 45,000 people, but we're not buying that anymore. We're not going for it. I know that you're a member of a fraternity, and the Divine Nine are very powerful people in our communities. A lot of folks who aren't aware that most people, most African Americans or any position of authority or elected, belong to some fraternity or sorority, and there's a power in that. Is there any movement to get more of the fraternities and sororities to take this issue on as we're moving forward and really upping the ante all the time with the level of the fight that we're in?
Well, one of the things you were spot on about in terms of us really working to encourage our communities to do things that are going to make sure that they're healthy and help them live longer. So making sure everyone gets proper checkups, making sure we're checking blood pressure and knowing what risk we may be of having hypertension or eventually heart attacks, knowing the dangers of alcoholism and substance abuse, and of course, tobacco usage. So we're working on that at the local level here, our chapter, and promoting healthy neighborhoods and communities. There's a group that meets at the Baby YMCA once a month on Thursdays. My Uncle Corey Monroe, some of the staff at the YMCA. It's just for black men to come talk about how they can live healthy lifestyles, talk about all the stress and the way to relieve the stresses. We're doing something in our barbershops now with the Baby Health Clinic, where you can come into my barbershop, my barber and the barbers in the shop know how to check your blood pressure, know what advice to give you and tell you where to go if your blood pressure is high. So we're doing everything we can to promote healthy communities, and that includes seeing a physician on a regular, learning what to do if you don't necessarily have health care, how to access health care, and of course, things to help you live longer, like preventing cigarette smoking, tobacco usage, as well as substance abuse support. So there are initiatives that our fraternity has, and we've been working with the rest of the Divine Nine on how we collaborate to get that information out into communities. And so you'll continue to see growth in how we work together to make sure that our communities are healthy. But we're already doing some of that work.
That's great. And so there's so much, half of this equation is the individual behavior lifestyles, and the other half is creating a community that supports healthy choices. As a teenager, I lived right on Thomas and Keefe, and I bussed myself out to Washington High School to go to high school using the address of one of my grandmother's friends, as did many of my friends to get a better education. And so every day we rode an hour and a half out, an hour and a half back, out from seeing what was happening in Bayview and passing by Western Addition to Fillmore, all the liquor stores, all of the things out to the pristine avenues. So we know that, you know, your environment has so much to do with how you feel, if you're hopeful about the future. And so what are some of the things that we're going to be doing so that it's easier to make a healthy choice? When I go to Marin, there are 3 juice bars, there are 5 yoga places. There are all these things that are there that are surrounding people, encouraging them to do the right thing. And in our community, as we know, when I come here often to eat, and I'm watching, you know, my brothers and sisters, some people who might be even related to me, walking up and down, you know, passing this corner, there's so many people in such a state of distress. So what are some of the communal things that we can do to better support you in some of the plans that you might have for our District 10, and some of the things that we might want to embrace as a people just to have better health and to make it sexy? Yep. You know, when you're trying to sell health, we need to use some of the things that people are using to sell us bad things to get people motivated to make good choices and do good things.
Well, there's several things. I mean, one of the things we're doing in our office is every development project that we have coming into the district, we're pushing them to have a grocery store or some type of grocer that is a part of their development, and making sure that they prioritize that in their development projects. What we also have done is pushed our liquor stores to put healthy products and put food sources and opportunity in the front of their stores versus all of the negative things that they may sell, like alcohol, tobacco products, and even some of these energy drinks that are high in sugar that we know lead to bad health for our communities as well. But what we also can do, in my opinion, and what I would love for communities to do, is to stop supporting some of these stores that have some of these products that they continue to put on all the corners in our communities. Because in some cases they're here, they're grandfathered in, and we're working on ways to make them become healthier. But at the same time, if we don't support some of these products and support some of the things that they sell in our communities, that will go a very long way. But that comes from community education.
Right.
We have to continue to let our families know and our communities know the dangers and the harms of some of the things that we are putting into our bodies and what they're selling in our communities. And that will go hand in hand. Once we continue to put that education out there, people make different choices, and people that come into our community, businesses that come into our community, will have no choice but to sell products that are healthy, because we will have made better choices and we'll spend our money on the things that are going to help us live longer and healthier lives.
And if we can get vegetarian hamburgers in the fast food restaurants, we can certainly get healthier choices in foods in our neighborhood.
Definitely.
So some of that is demand, that we take responsibility and want something better for ourselves as well.
Right, and it's all demand in
Yes.
terms of how they market and what products they decide to sell in our communities. So we have to continue to educate and work on making healthier choices.
Okay. Before we open it up for questions from the audience, we have so many higher, because of term limits, people rise up from San Francisco. So we now have our former mayor, Gavin Newsom, who's the governor of California. He created the position for the first California Surgeon General, who's Dr. Nadine
right.
Burke-Harris, who opened up an office there
That's
on Evans and treated whole families, giving people good care, probably some of them for the first times in their lives. And she's really working on adverse childhood experiences. And we talked a little bit about loving our babies and having people have healthy, happy childhoods. So is there any plan to have her come and shed some love, in particular on San Francisco, since this is where she got her start? I was so excited when I found out that he had created that and appointed her to it, because she's the perfect person.
No, I definitely share your excitement. In fact, when I found out that she was appointed the first Surgeon General of the state and she had a reception here in San Francisco, I changed my whole schedule around so that I could go congratulate her. Her trauma work is unmatched,
Yes.
Not only here in San Francisco and the state of California, but across the country. And so to have her in that position, because again, there's a focus on health and the whole person. And so that was exciting for her to be in that position. She's all over the place in a good way, in terms of being the leader of the state in the medical field. And I would love to have some type of session with
Bring her
her
back
and bring
home.
her back home.
Yes.
And we'll effectively make that happen at some point. But I know she has a big job right now, and she's been doing a lot of work connecting with communities across the state and across the world, quite frankly. But I would love to work on something to bring her back.
And I believe that she will, because the U.S. Surgeon General is such a political position, so half the time they can't even really do what they want to do. Right. And I believe she's really going to give them some competition because she will be free to really run her agenda to take bold leaps forward. So I was just so enthused about her. So right now we're going to open it up to our wonderful audience here. Do any of you have any questions for our supervisor?
Nope.
We're doing such a good job.
That doesn't happen often.
Thank you so much. I just wanted to thank you so much for the comments. I work at General Hospital in the city, so I'd like to ask you if there is any way that we could help weave into the community. Particularly, you mentioned some of the barbershop where you may have had the conversations with African-American men. So we also sponsored a few groups that are dealing with the African-American patients that have prostate cancer. So we're happy to accommodate working with you if there is any way that you have some initiatives that you'd like to inform us about. You can have my contact, and certainly I'll be putting you with some of the providers so that we can better communicate with the community as the center's trauma center.
And thank you. And I think it's really about being consistent in terms of how often we're in community. And so working with the Department of Public Health, we have at least a few clinics in the district. And so we can work through the clinics, we can work through our barbershops, we can work through our community-based organizations to get the right information about how to live healthier lifestyles, what you need to do, how often you need to go to the doctor, the things that you can do at home to keep yourself healthy. So I'll definitely connect you to our team so we can collaborate on some of the things that we're doing because we are working with some of the clinics. Some are connected to the Department of Public Health, but there's so much more we can do, and we need to stay consistent. And you being a black man in the public health field, that's important too, because we have a lot of people that come into community that community can't necessarily connect to, and we need our people to see people that are professionals in the health field, in the medical field, that look like them, because it makes it easier to make that connection.
I didn't have a question, but I just wanted to make a comment. And first of all, to say thank you to Carol and Supervisor Walton for just having the forethought to have this opportunity to sit down and talk about these issues. This is exciting for me, being native of San Francisco and growing up in the neighborhood as well, and also have 3 children that live in the neighborhood currently. And so I appreciate you all and your efforts and your work. Carol, been knowing you for a long time and always been just the biggest advocate in our community around tobacco. So appreciate your good work. And I just want to, put a plug in for the African American Art and Cultural District. We would love to collaborate because health and environment is one of our sort of core areas we want to focus on in the cultural district here, Bayview, Hunters Point. And so I put me in on collaborations as well in terms of whatever planning and ideas that we collectively can come up with as a community to really address health and education and prevention in the Black and African American community. I really would like to see that happen. So put my name down on that, and let's, like you say, it's being consistent, so let's build something with a good foundation and not just do a one and done, but let's plan something to really put it out there for our community to educate them for a period of time,
Exactly.
over time.
And I want to just add on, so I want to give another plug for Amplify, which is our statewide project. The website is amplify.love, and we actually have a leadership development program because much like the criminal justice system, In the criminal justice system, we're the defendant, and in the public health policy system, we're the patient.
Right.
And there are all these people around us who make a good living off of us. And in the criminal justice system, you have the judges, the bailiffs, the probation officers, the jailers. And then on the public health policy side, you have researchers, you have advocates, you have program managers. And so there's a lot of funding and jobs that have become available because we passed the tobacco tax, Proposition 56.
Right.
And our goal is to be the guide for our people so that they are aware of these careers that are there so that we can step in and we can save ourselves rather than be depending on people who don't know us, who might not have our best interests at heart. They don't know how we work, you know, like this woman knew how we worked. And so you can't help us if you don't understand us and you don't love us. You know, it's very hard to do that. So amplify.love, people can go on if they're interested in it's a virtual leadership program, and you know, doing with your work with community developers, it takes a lot of work sometimes to get people ready. But first they have to know where they're going too.
That's right.
So we're going to show them where it is, and we're going to help them get there and provide connections and networks. And I think, yes.
I have a question, and first I'd like to thank you, Ms. McGruder, and you Supervisor Walton. One of the things that I'm hearing in all of this is that there needs to be public education of our people. And one of the things that I see is that there is a trend toward less public affairs programming, where there is a situation where there is not the public interest that is being taken care of over the airwaves, and also in many of our newspapers, and I'm not speaking of the San Francisco Bayview newspaper, of course, because they are very community focused, but there's a lot of community news that never gets out, and as a result of that, people are not educated. It would be very difficult to have a mind shift if you have all of these commercials about how wonderful it is to smoke, how wonderful it is to do the various things that are harmful to our bodies, and then there is no countermeasure or counter message because there's less and less public affairs programming. So is there going to be any kind of action on the part of San Francisco supervisors to start demanding that the airways once again give out positive information to help people as opposed to just focusing on crime stories, both on the airways and also in the newspapers, because it impacts what you see is what you repeat. So what about that?
Well, one of the things, it's funny that you asked that question, because when Ms. McGruder and I were talking before we started the interview, we were talking about who controls the media. And as you know, those public and community voices don't control the media. And so how do we combat the fact that the people with the dollars that shape the stories don't necessarily share the voice of community? And how do we support our presses of color, which we've gone away from. All the media outlets that we had that had the voices of color, we've gone away from that. I won't watch BET because whoever owns it, and I know it's not the original black company that owned it, but it's a lot of trash that is being put into the minds of our young people in particular, but into our communities. And so, to your point, there has been outcry from my office as well as some of my colleagues, and focus on making sure that we're not just promoting the negative stories in our communities. And in fact, a lot of times when I get called for certain interviews, I won't respond if it's just going to be a negative message, particularly if it's about trying to paint my community or our community in a bad light. Because there's so many wonderful things that are happening here in our community that we see on a daily basis that need that attention. So when we go give out scholarships, we need to promote that. When we go out and we have young people who are working in internships in engineering and architecture and receiving opportunities and pathways for growth and becoming successful, we need to go and promote that. And we need to start bringing out the media to those events. So we're going to continue to push that. There's a lot of conversation about not responding to those requests, but there's also the fact that people want to get their platforms out and people want to get their messages out. So sometimes people are not bold enough to say no to media, because when you do that, you don't get that exposure. And you know, it takes strong folks to say, if we're not going to put the right message out, then I don't need the exposure.
Exactly. And that's one of the reasons why we wanted to have this forum, because we wanted to have a conversation. As you know, when you do an interview, it's a sound bite, and they might cut up what you said,
Right.
and it's not even what you intended to be, you know, wasn't the most important part of the message for you. So we need to have opportunities to just sit and talk and have a real conversation. These are complex issues, and they need some sentences. They
right.
don't need sound bites. And so I just want to thank you today for coming out and spending some time with us. This is going to go out all over the country. And so how can people who are living outside of San Francisco, how can they support some of your efforts and initiatives? Because what we do here people are going to benefit
Right.
from it sooner or later. So what are some of the things that we can do to support you? And then I'll let you close it out.
Definitely. Well, one of the things we do in our office, we put out a newsletter, and so people can definitely, send me an email if they want to learn about all the things we're doing in the District 10 office. We're listed on the website. You can go to San Francisco Board of Supervisors, and all our information will come up, tell you how to get in contact with the office. We love to get information about what we're doing out in our newsletter. We also host many community events and forums, and we put that information out for people to hear about it. At least once every other month, we're in all of the neighborhoods in the district having some type of forum, whether it's about community safety, community health, whether it's about workforce development, or how do we help our young people succeed and become successful. And so those are some ways to engage, by going to the Board of Supervisors website and getting that information. But outside of that, just continue to reach out to our office. We'll respond and let you know everything that we have going on. And come visit our district, come visit our community, come support the businesses that are here, which is very important. If you support the community in District 10, support our small businesses, that's supporting our offices, and that's one of the main things that gets us excited as we look at how things are changing for some of our small businesses, particularly businesses of color. I just would ask that people come and make Bayview, make Potrero Hill, make Dog Patch, make Visitation Valley a destination place for you and your family.
All right. Well, thank you so much for your time. Oh, you have a question, Mr. Ratcliffe?
Well, more than a question. Well, I'm really glad that we had this meeting. Our paper, if you're starting at the bottom, helping people, and we do it for people that's in prison,
Talking to the mic,
and
yes.
people that's not in prison.
Yes.
But we do need communities' help, because it costs to put a paper out, right? And I'm not afraid of anything,
No, you're not.
no. But I came from a family that for over 200 years, and we still in the same place down in East Texas. The county that I was born in, we had the only vigilante war in the country. We had to fight. So black people in Shelby County was always done well. They always, we got the schooling, we made sure everything that white people got, we got. So at age 87,
All right.
I'm still kicking.
That's right.
And of course, I'm the only one left in my family. Right. But I would like to see our people, because when you look at it, it's about the money.
Yes.
It's about the money. But we don't come together to make where we can control things by putting our money together. We'd rather run over here to this white bank, stick it in there, and then when you want to borrow something, you can't get a dime. Right. You can't get a dime. So we either need to start our own bank and work together. And that's what I'd like to see happen before I pass from here.
All right.
but we do need the community to support the paper.
Yes.
Right.
And I want to say that the San Francisco Bayview, they have always supported my work over all these years. They have always ran our articles. You've always been involved, and that we pledge has amplified that love, that we're going to take a more of an interest in some of the media dollars that are spent on tobacco control. We've been trying to do that, but that we're going to get back re-involved with you and help to keep the San Francisco Bayview alive.
Yeah, well, we need to support. It costs money to do all of that. But I love the fact that what we did for the prisoners,
Yes.
and we had them to start fighting. If they can do it in prison, we should be able to do it out here.
Yes,
right.
we should.
Right.
Yes, we should.
That's why they had all those prison
All
strikes.
right. Thank you, Mr. Ratcliffe.
All right.
Thank you.
Thank everybody.
Okay. All righty. So we are right about 5 o'clock, I believe. So we're going to close it on out. So any final thoughts?
No, I just want to say thank you for hosting this and having this conversation. I think we need to do more of this, like you alluded to a little bit earlier. And I'm excited to come out and looking forward to the next conversation as we continue to make sure that our community has the right information so that we can all be successful, continue to stay here, live and thrive in San Francisco. And I just look forward to doing this in the future.
All righty. Thank you so
Thank
much.
you.
Appreciate you.
Of course, appreciate
And this
you.
lady is happy.
That's right. That's right.
All right. Thank you. Thank you, everybody.